Hey everybody, Nick Licameli here, back at you with another episode of Technique Peak. We got a good one for you today. It's all about what I think is a chronic problem throughout our profession, and it is underdosing and underworking the elderly population. The elderly make up a great deal of our patients. Many of these elderly patients come to us for strengthening, balance training, gait training, and to reduce the risk of falls. But I think we're doing a disservice if we don't challenge these people. All the same rules apply that apply to other patient populations. In order to get stronger, we have to apply progressive overload. We have to stress these patients. We have to push them. If we want to improve endurance, we have to work them and get their heart rate up. If we want to improve strength, we have to get their muscles burning. We have to challenge them. Today I'm going to show you just one way to think outside the box to do this. Be sure to watch this one all the way to the end. Trust me. So that's not exactly true. I did take a couple to the chin here. I may have cried once or twice. I'm not proud of that, but anyway, moving on here. This circuit that we're doing here is just a simple combo, 4 punches with 2 ducks. So obviously the punches are working on her core stability. She's rotating, she's planting her feet, she's producing power, she's balancing, she's weight shifting, and she's reacting, and she's ducking. So she's doing a bit of a hip hinge to duck out of the way. So the next circuit here, we're going to add in some kicks. So we're going to go 4 punches with 2 kicks and then a duck. So the kicks obviously are training single leg stance pretty dynamically, and she's producing force in single leg stance, which could be important in things like the single leg stance portion of gait, so she has power to push off, or like negotiating stairs. And again, the duck is kind of training her to have reactive balance, and that reactive balance is very important in preventing falls. So the next circuit, we're going to add in a sidestep. So sidestepping is great to train the gluteus medius. Now, gluteus medius strength has been correlated with improvements in balance and proprioceptive performance. Remember that correlation does not equal causation, but it's still worth noting. I also like this because it forces the patient to keep their head up, right, and their eyes forward. A lot of times I see with gait training and sidestepping, the patient tends to look down to the floor to watch their feet. But when we walk, when we step, when we try to balance throughout our day, our eyes have to be up. You can't really see here, but she has a TheraBand around her knees to provide some resistance with the sidestep. Up next is quite possibly my favorite circuit. It involves a sit to stand. So we're doing a 4-punch combination with a sit down to the chair and a stand back up. And we're training this sit to stand and squat pattern, and the punches, what it allows is she's not focusing on the squat, right? She's just doing it. It's becoming a subconscious movement pattern, and in the steps of motor learning, that's what we want. We want there to be less thinking about functional activities and more just doing. It's also training full body endurance, right? Because not only is she repeating the sit to stand, she's also using her arms, and that's quite a workout for her. Don't be afraid to put some of our gait and balance and elderly patients on the arm bike. Add the UBE into a circuit, and it'll really help train that total body endurance. Up next, we have everyone's favorite balance tool, the foam. So now she's standing on the foam, and we're just doing the same combinations we did before, but obviously this is challenging her balance a bit more. I don't know if you can tell from the video, but she is going a bit slower. Because she did feel herself, her balance getting challenged. So she slowed down her speed, and now she's kind of working on her balance and stability as she does this. If nothing else, activities like this give the patient a sense of confidence. It really shows them that they are capable of so much more than they may think, and this reduces a fear of falling. And fear of falling is one of the top risk factors for having an actual fall. So obviously if the patient is impulsive and has poor safety awareness, this is not the activity for them, and as always it depends on the patient. So this is another one of my favorite circuits. It involves turning, so it's just a simple 1, 2, 3, 4 combo and a turn, 1, 2, 3, 4 combo and a turn. Majority of falls actually happen during turns and change of direction. So this really trains the patient to change direction rapidly and produce force with the upper body, so she's using her entire body to stabilize herself as she's punching and she's turning rapidly. The last thing I want you to make note of is the patient's face. So she is having a good time. She likes doing this. It's fun. When else during her day does she do anything like this? She's so engaged. She's fully engaged. She's not watching TV. She's not talking to someone else. She is focused on the activity at hand, and she's having a good time, and she is working hard. Make no mistake, she's having fun, but working hard. And there is no better combination than that.
Good, 5 more left. That's it. Watch it, watch it, watch it. There we go, come on.
Thank you so much for watching this episode of Technique Peek. I hope this helped, and we'll see you next time.